Our hospitals are under siege, and our model shows no end in sight. The worst is still before us.
That the top health official in LA County, California, added 41,000 new cases in just the last 24 hours. It's a new record for any state on any given day. Many hospitals totally running out of ICU beds, and in Southern California, the intensive care units, they're nearly 100% full. Unfortunately, many areas of America dealing with the exact same problem. Take a listen to this doctor in Pasadena describing what they're dealing with.
Normally we have a 30-bed ICU, but right now we've got extra beds in our recovery room. We have extra beds in our endoscopy suites. We've taken over part of the pediatric ICU for adults. So we have them kind of spaced all over the hospital. We're barely able to take care of the ones we have right now. So that's really the message. We're really on the breaking point.
And nationwide, the numbers nothing short of horrific. 3,600 Americans have died in just the past day, making it the deadliest day yet as we approach 310,000 fatalities since this pandemic began. Now, this country has also had nearly 250,000 new cases just yesterday. And as you can see from this map, every single part of the U.S. is being impacted. The darker the colors, the worse it is. Politics also appear to be a factor in the severity of this outbreak. And this chart tells the story. States that voted for President Trump tend to have higher caseloads when you compare that number to how much those people read about COVID out in line. So here's the takeaway. Red states more likely to have less accurate information about the virus, instead getting their news about it from the White House itself, making them more susceptible. Now, the only good news I have for you involves those vaccines. Moderna's inoculation just cleared another key hurdle at the FDA. It could get approved for emergency usage within days. It is similar to the Pfizer vaccine, and Moderna's actually has some advantages.
From an efficacy safety point of view, they're nearly identical. One's a little bit easier to distribute, doesn't have to be kept frozen. That's the Moderna one. I doubt most people will have a choice, and it shouldn't really matter. They're about the same once it gets into your arm.
But another challenge remains. Will enough people be willing to take it for it to be effective and kill off the pandemic? 75 to 80% of the population has to get the shots here. And a new poll from Kaiser shows that 7 in 10 willing to get vaccinated. That is up more than 8 points in just the past few months. So that's good news. That's the general public. Many frontline healthcare workers, though, they're also surprisingly reluctant to take it. A doctor at one of Houston's largest hospitals says half of the nurses in his unit don't want the vaccine, many of them Black or Hispanic populations that tend to be particularly skeptical. My next guest, he works for the hospital system in New York that gave the first shot in the United States.
This vaccine is exciting because I believe this is the weapon that will end the war. It's the beginning of the last chapter of the book.
And for more, let's bring in our guest, Dr. Eric Choi-Pena, emergency room physician for Northwell Health System, also the system's director of global health. Hey, doctor, always great talking to you. And I got to imagine, must have been a real proud moment seeing one of your own from Northwell there being the first one to get the vaccine, Nurse Lindsay.
Yeah, it was great. We're super excited about this. This is, as many people have said, the weapon we were waiting for that will hopefully end the war. And I'm excited to see a lot of my other colleagues getting vaccinated as well. We're definitely, the emails go out on almost a nightly basis for the next kind of part of phase 1, and everyone's eagerly awaiting them. So I think people are really excited to have this protection.
And as I understand it, this Saturday, you yourself are going to get inoculated. Is that right?
Well, actually, they moved it up. I got inoculated yesterday, and they had an extra dose, and so I was already there. So I got the dose yesterday. So I'm feeling good. I got the shot on my left arm yesterday, and I'm super excited that I have this protection soon.
So walk us through when you're going to get your second shot. Did you have any adverse reactions to it? Pretty soon a lot of my audience is going to be going through the same thing. If you don't mind, talk through how the process works.
Yeah, so it's just like a flu shot. It's in your arm of your choosing. Some people say it made their arm sore. My arm was fine. I went out and shoveled snow this morning, so I didn't have any adverse events at all. I'm feeling pretty good. My energy's up. No arm pain at all. It hurt a little bit less to me than like a tetanus or a flu shot, in all honesty. And I get my next shot in 21 days or 3 weeks from the day that I got the last one. And I'm excited for the second shot as well, because I know that significantly increases the percentage effectiveness from about 60% to over 94%.
That's fantastic. It's interesting. There's a Kaiser poll out there. We just showed that about 70% of the people now seem to be willing to take it, but yet we're seeing, and I played a clip coming into this segment from Houston area hospital, the head of the hospital, saying that some of the staff is wary of taking it. What's the best way you think we're going to get to combat the skepticism that some might still have? And obviously in communities of color, there's an ugly history in this country going back many years ago. How do we get through that so we can get to the 3/4 or 80% that we really need to get herd immunity?
Yeah, I think it's a combination of listening to people's concerns and answering them, leading from the front. So, make sure that you yourself, when you're eligible to get vaccinated, that you're not expressing any hesitancy, and just making sure people fear the unknown. I don't think most healthcare workers, when they understand the actual risks and benefits, the benefits are overwhelmingly greater than the risks, and most healthcare workers are going to have no problem taking this vaccine.
The other reality with all the great news of the vaccines, and it is an unqualified great news, we're seeing projections now from the CDC, doctor, that 80,000 people between now and the end of the year will no longer be with us. How, from a capacity standpoint, and I know you're in contact with people from hospitals from across the country, how worried are you that now we're going to add the holidays to the mix as well? We're already seeing the surge from Thanksgiving impacting, far better than me, ERs across this country. How concerned are you just how bad this is going to get for the next couple months here in this country?
Yeah, I'm very concerned. I think January may be our darkest month in the entire pandemic. And I think that the vaccine is welcome news, but it's not a get out of jail free card. It doesn't exempt us from all the other public health and social distancing measures that we've taken thus far. This really, the one thing I think it does is I think it should steel our resolve that this is our last push. This is our last big push before we can say bye to COVID. And so I hope that people hunker down for Christmas, hunker down for Hanukkah, hunker down for the holidays and for the new year. I'm afraid that they won't, and we are already looking at ICUs that are at capacity, medical surgical units that are at capacity, both in the tri-state and countrywide. Healthcare workers are tired. We're not going to have much of a holiday. We're already tired, and we're heading into another surge right around time when traditionally we take breaks and rest. So I am concerned about that. We're asking Americans to be responsible, to wear a mask, to not travel for this holiday, and keep as many people alive as possible so we can get through this last phase.
And Doctor, we've talked over the months, the sacrifices not just you, but your colleagues have been going through for this. But, I see one of the realities that I learned was in the spring, the cavalry came to New York from other areas of this country, nurses and doctors. The cavalry's not coming because it's everywhere across this country. And a lot of the places that had no exposure to it in spring, they're now the worst or hardest hit places in this country. That's got to be part of the equation here. In addition to having your colleagues getting sick and losing some of them now fighting this pandemic, you don't have extra folks to go around to fill in for the folks, out of necessity, let alone those that have to be replaced.
No, absolutely. Yeah, there is no kind of cavalry coming in. And we actually, we honored recently a reciprocal agreement that we had with Henry Ford in Detroit. And we sent a team of nurses at their request there because they sent them to us in the spring. We honestly didn't have them to spare. But we knew that they were getting harder hit and they needed them, and we had made the promise. But these agreements where everybody focuses on the area that's getting hit the hardest, and the staff roll in right now, that's not a reality. So we are looking at really creative ways to redeploy staff, to maintain the quality of care, to try and keep the rest of the health system up and running so that people with strokes and heart attacks and life-saving surgeries don't have to defer those events. And so it's a complicated game, and it's a complicated math equation to keep everything running so that we don't lose lives, not to COVID, but as a kind of a secondary cause, while also saving as many lives due to COVID as possible.
Hey, Dr. Pena, I know it doesn't go that far, but again, thank you so much for everything that you and your colleagues are doing, and have a good holidays for yourself. I know it's going to be trying times, but again, thank you for your service.
Thank you so much.
All right, everyone, when we come back, we're going to pivot to politics. We're going to speak with Matt Taibbi. He's at the Rolling Stone about what is next when it comes to the Democratic Party, who is not united right now. Trump may be on his way out, but how will the Dems handle taking back the White House and also division within its ranks?